Hello, citizens. My name is Andy, the antibiotic,
I'm Benji the bacteria.
and we are on a mission from the Ferris College of Pharmacy to educate you about antibiotics. College of Pharmacy has given me a survey, and we're going to take this survey into the world to ask the questions to you.
And if they get them wrong, that's okay. We'll tell them the right answer.
Your health is important, so stay healthy, citizens. So let's go for medicine. Alright guys, true or false? Only bacteria are killed by antibiotics.
False.
Antibiotics can only kill bacteria. Allow me to demonstrate. This is our antibiotic, and this is our bacteria. Since antibiotics can only treat bacterial infections, our antibiotic can easily take out this bacteria. However, in the case of a viral infection, antibiotics can't do anything to treat it. Okay, citizen, your question is, which of the following is caused by bacterial infection?
Sore throat, bronchitis, the flu, or urinary tract infection.
Is it bronchitis?
That is incorrect. So the flu is a viral infection, so antibiotics just can't treat it. A sore throat, however, can be caused by either bacteria or a virus, but most likely the cause will be viral. Same thing with bronchitis, it will most likely be a viral infection. Out of that list, the infection that will most likely be treated with antibiotics is the urinary tract. Okay, citizen, your question is true or false? Any exposure to bacteria or viruses can cause an infection.
True.
Exposure to bacteria or viruses does not guarantee infection. Picture this. This is you. This is the number of viral agents and bacteria that surrounds you on a daily basis. If we were to get infected by simply coming into contact with one of these guys, that would be insane. We would get sick pretty much every day. Thankfully, our immune system protects us from a lot, but in case of infection, here are some things you can do. In the case of a bacterial infection, take an antibiotic and that should help you out. In case of a virus, manage your symptoms. Play the waiting game, and the body should clear out the virus on its own. Alright, so your question is, which of the following can be treated by antibiotics? The flu, a sinus infection, sore throat, or an ear infection?
A sore throat.
So since a sore throat will mainly be the cause of a virus, an antibiotic will usually not be able to treat it. The common cold and sinusitis will be the same way. However, an ear infection will mainly be the result of a bacterial infection, making it the most likely candidate for antibiotic treatment. Okay, so your question is, true or false? Repeated use of antibiotics may decrease their effectiveness.
True.
If someone's using an antibiotic frequently, the effect can potentially decrease as the bug can learn how to adapt. This is what we call antibiotic resistance. What causes antibiotic resistance to occur?
I have no idea.
So what causes resistance? Over time, the bug learns to resist the antibiotic that was initially meant to treat it. Eventually, it could grow to be stronger than the antibiotic itself. According to the CDC, resistance is urgent to public health. But how does this happen? A couple of things that can cause resistance to occur is the overuse or misuse of an antibiotic. Alright, true or false? Antibiotic resistance is likely in someone who recently took antibiotics.
True.
Resistance is most likely in someone who recently took antibiotics. Therefore, it's really important to know how to protect yourself from resistance. Never skip doses, never save an antibiotic for the next time you're sick, and please do not take an antibiotic that was prescribed for somebody else. What is a common way to get an infection?
My ex-girlfriend?
So what is the most common way to get yourself infected? It's not washing your hands. Shocker, right? First of all, if you don't wash your hands, you're just gross. That's just gross. Second of all, when you don't wash up, you're taking lots of bacteria with you that can infect yourself or someone else. So please, just do us all a solid. True or false, citizens? Vaccines make you sick when they're working. True. So after you receive a vaccination, you can sometimes feel some symptoms as the vaccine stimulates your immune system. You're not actually sick, however. Let's take a look at the flu shot for an example. According to the CDC, some of the common vaccine side effects include redness or swelling, low-grade fever, and muscle aches. But there's no need for a doctor. This is completely normal and should be gone within a day or two. Well, that was quite the day, and now that it is all of a sudden snowing out of nowhere, it's time to be extra careful.
I am everywhere.
And that's right, now that he is everywhere, it is important to get your scheduled vaccinations. Keep up that and you will be perfectly healthy. Stay healthy, citizens. See you next time.